listen, you're a medical practitioner, but you specialise now in cosmetics.
Well, I do some cosmetic medicine,
Yeah.
but it complements the chronic illness medicine that I do, you see.
Interesting.
So what happened was that about 15 years ago, as I was building up my chronic illness practice, I decided to learn to use botulinum toxin for tension, headache and migraine.
Right, so tell us a bit more about that.
Well, in fact, I've researched it and given a lecture on it as well at an international conference. But believe it or not, people who are suffering severely from tension, headache and migraine can get relief with botulinum toxin.
So botulinum toxin is what exactly?
Well, the brand names that are out there are Botox, Dysport and Xeomin.
Right.
And what it is very, very dilute, purified poison.
Oh, weird. So you could get Botox because you've got a migraine and it would help to ease that?
In many cases, but we need to know that the headache starts in a certain place, and there's a whole lot of criteria that we use to help us understand whether the treatment will actually work.
Right.
So, but I only use that in my clinic as a last resort because I'm able to address all the medical root causes.
Yes.
And I tend to use it only if I have to, or if I want to give that person a period of relief while we're getting everything else done.
How interesting.
Did you know that if you put botulinum toxin in the frown lines, that it reduces depression?
Oh, really?
Yes.
Oh, actually, I could do with a bit right there. I have got.
Well, come and see me anytime.
Okay, I will. So tell me a bit more about this whole thing about cosmetic medicine is a little bit controversial. What kinds of people are actually using it now?
Everyday people are having cosmetic medicine. They're doing it because their grandchildren are saying, "Grandma, why are you frowning?"
Yeah.
Or if you're a teacher at school and you don't want the children to think you're angry at them because you don't even know that you're frowning.
Yeah.
Or if you're a business person and you want to look more approachable.
Yes.
So there are business people telling their colleagues, "You go and get your botulinum toxin done so that you can look more approachable."
Oh.
We have got people seriously needing to look younger to remain in work because of the ageism
Yes.
that is out there. And whether you like it or not, the nicer looking person gets the job.
Yeah. Yeah. Well, I guess in some way we're conditioned to think that nicer looking people are more approachable in some way.
There's something about your appearance somehow opens more doors for you.
Yeah.
And people, I think, have picked up on that, and they'll do anything they can to remain in work and be successful.
And it's mostly women, I imagine, or is it?
The men are growing, and they're doing it for other reasons. They're also doing it because we've got one patient at the moment who's a lovely man, and he works in corporate, and he's sick of his acne scarring from when he was young.
Yeah.
And after our first needling with platelets treatment, we call it the vampire facial. Yeah. His skin is softened in one treatment, and he loves it, and it's helping him because, you know, he's got to look good in his corporate. So men are getting into this a lot more. They're having the Botox for the approachable look. They want to look better. Men are having fillers as well.
So what trends are you seeing now?
Well, what we know from a lot of the international studies is number one is the botulinum toxin.
Because I can feel myself frowning. I can literally go, what trends? I go, don't frown, don't frown.
So you've got the botulinum toxin because it's easy, and you walk in and you walk out, and it's affordable.
Yeah.
Right.
So typically, how much are we talking about?
Oh,
just asking.
In New Zealand dollars, you might be talking about $200 or $300 for your frown line.
Yeah. And is that lasting though?
Well, it depends on the product, and it depends on how much you use. And some of the products last longer than the others, so you're getting 3 to 5 months out of it. But the thing about the frown line is that because you get out of the habit of frowning, your wrinkles remodel and you stop frowning, and then you need less and less.
Oh, that sounds good. That sounds good. I'm actually going to stop frowning now. There we go.
All right. Now, the second trend for cosmetic is dermal fillers.
Right.
And the third trend is the vampire facial. This is using your own platelets from your blood to do the rejuvenating of your skin.
So what you're talking about is stuff that's already inherent in your blood can heal and and sort out your skin.
And that's what I really like about what I do, is because I can use platelets medically or cosmetically.
Right.
So what platelets contain are more than 30 growth factors that will go into your skin or your knee joint or your shoulder joint and say, okay boys, what do we need here? And they'll put out what they need to regrow, correct, reduce pain, reduce inflammation, and they stimulate your local stem cells. So this is your own repair kit.
Oh, interesting.
Yeah.
So obviously some people have had cosmetic disasters out in the world. What advice would you give someone if they're thinking about going on this journey of adjusting their appearance a little bit?
Well, I think if you can, you need to look after your internal health first, because that really will enhance your external appearance before you've even started.
Yes, great advice.
And then I think there's been an increased trend towards non-surgical cosmetic treatments. People are moving away from having a facelift or having an operation, which carries with it risk and downtime, to things where they can just walk in, walk out. So the advice that I would give is that you would look at a balanced, holistic approach to the people that are treating you. You'd ask as many questions as you can. And the people that are treating you should be giving you all the information, and we call that informed consent.
Yes.
So you need to know what else you could do, what your options are, and what could go wrong.
Yeah, and I like the idea that you have about a holistic approach. You know, it's not just, oh, I'll live a really awful lifestyle and then just try and fix my skin.
Exactly.
Yeah.
It's much better. And with my chronic illness patients, what happens is that they start to look better as they get healthier.
Yes.
And then some of them say, oh, I'd like a bit of appearance medicine now.
Yeah, and hey, nothing wrong with feeling great.
Exactly.
Brilliant. Thanks for joining us, Frances.
My pleasure.